Welcome back friends to another session of Mnemonics in Dermatology. So let us proceed. So we have a question here on pityriasis rosea. Which of the following is not a feature, which of the following is not seen in pityriasis rosea? So Christmas tree pattern, HHV7, that is herpes virus 7 association, self-resolving erythroderma. So what is the answer? So pityriasis rosea is an important topic. It is a papulosquamous disorder, meaning it presents with scaly lesions, erythematous papules, plaques, macules also. So along with this lesion, there is a special character to the scales in pityriasis rosea. So as you can see over here, the scaling is attached on the periphery and free in the center like a collar. So attached at the periphery, free towards the center. So it is arranged like a collar, that's why we call it as collarate of scales. Similarly, when you see the lesions, they appear like this. On the back, the pattern is inverted. To be more specific, Christmas tree pattern, right? So the mnemonic for pityriasis rosea is very simple. So her mother Rose celebrated Christmas by herself. So please write this down in your mnemonic book. So her is herpes. So pityriasis rosea is associated with HHV virus, that is 7 and 6, 7 more than 6. So in MCQ if they ask you 1, you should mark 7 first. Mother is mother patch. So mother patch is the herald patch that we see. The biggest lesion, the first lesion that appears in pityriasis rosea is known as mother's patch or herald patch, right? Rose is pityriasis rosea. So the mnemonic is for pityriasis rosea, and celebrated is collarate like scales, and we have Christmas tree pattern for Christmas or fir tree pattern, and herself is herald patch, which is another name for mother patch, right? Self is self-limiting. The disease itself is self-limiting. There is no need of any specific treatment. It will resolve on its own within 2 to 4 weeks. So let us come back to our question. Which of the following is wrong? So please recall the mnemonic. So Christmas tree pattern, HHV7, self-resolving. All the three are seen in pityriasis rosea except erythroderma, which is not seen. Right? Clear? Alright. Another important papulosquamous disorder. So not that important as compared to psoriasis and pityriasis rosea. Only 3 things you should know regarding this disorder. It is itself hidden in its name. So the disorder is known as PRP, pityriasis rubra pilaris. So pityriasis rubra pilaris, the meaning is pityriasis means scaling, rubra means red, and pilaris means related to hair follicle. So here we see multiple follicular papules, multiple erythematous follicular papules. So this entity PRP has total 3 features, important one which you should know. The full form itself will reveal that. So PRP, palmoplantar keratoderma, that is thickening of palms and soles. So palmoplantar keratoderma. Then we have R for orange red erythema. So the patient has diffuse erythema, orange red, plus follicular papules. So follicle centered erythematous papules the patient will be having. So if such a case scenario is given to you, think of PRP, pityriasis rubra pilaris. Alright? Right. So which of the following is not associated with exfoliative dermatitis? So what is the meaning of exfoliative dermatitis? Another name is known as erythroderma. It is another name for exfoliative dermatitis. So there are multiple causes of erythroderma. So let us go through the list. The mnemonic is quite simple. You have to remember it. ID scalp. So ID scalp. So erythroderma, as you can see here, we have diffuse involvement. More than 90% of the body surface area is involved in the form of erythema with or without scales. So erythroderma has multiple causes. Idiopathic, I for idiopathic, right? No cause known. D for drugs. So important drugs, phenytoin and allopurinol, 2 important drugs. Scalp, S for seborrheic dermatitis. Various forms of dermatitis can cause erythroderma. One is seborrheic dermatitis. Second is contact dermatitis. C for contact dermatitis. A for atopic dermatitis. Then we have got L. So L is for lymphoma and leukemia, cutaneous leukemias. So leukemias which can infiltrate the skin. Cutaneous lymphomas can cause erythroderma, right? And P for again multiple P, psoriasis, PRP, pityriasis rubra pilaris. We have got Parthenium dermatitis. So because of Parthenium weed, so it's a form of contact dermatitis which can lead to erythroderma. And another P is pemphigus foliaceus, which is a variant of pemphigus, right? Now coming back to our question, which of the following is not associated with exfoliative erythroderma? So psoriasis, phenatoin and cutaneous T-cell lymphoma, they are all associated except acanthosis nigricans. So please remember A here, A is not acanthosis nigricans. What it is? It is atopic dermatitis, right? And sometimes they will label like cutaneous T-cell lymphoma. In the mnemonic we have lymphoma. So make sure that you note down everything correctly in your mnemonic book and you have to revise it. Otherwise at the time of exam you will remember ID scalp. So A is there in scalp, P is there, C you are not sure. So L, it was L in our mnemonic. So you should be perfect. Whenever you make mnemonic, please write it down and please revise it multiple times. This is the only way. Revision is the key. Right. So another case scenario recently asked, a 30-year-old female who presented with superficial vesicles which are fluid filled. Also she has got bullous lesion which rupture easily. And along with that, she has got erosions with crust which are formed when the vesicles and bulla get ruptured. So skin biopsy they have shown which, so they are telling us the skin biopsy is showing suprabasal bulla. So what is the diagnosis? So we have got these options here. So immunobullous disorder is a very important topic. AIIMS, Neet, every time they are asking. So please pay attention. So immunobullous disorder, how do we classify? On the level of split. So we have two levels here broadly. One is intraepidermal. Inside the epidermis there is a cleft. Then we have got dermoepidermal or subepidermal. The details of immunobullous I will not be talking about here. We will be focusing just on mnemonics and relevant important points, right? So two major subset, intraepidermal and subepidermal or dermoepidermal. So whole epidermis above and rest of the dermis below and gap between, right? So intraepidermal, again we have two subtypes. One is subcorneal. Below stratum corneum there is a gap. Here suprabasal. So we have a single layer of basal keratinocytes above which there is a gap and the roof is formed by rest of the epidermis including stratum corneum. Alright, clear? So the examples of this are very important. So we have got subcorneal split. So diseases with subcorneal split including non-immunobullous disorder. So there are various other conditions apart from immunobullous that can present with blisters like bullous impetigo, it's an infection. Staphylococcal scalded skin syndrome, they can also present with subcorneal split. So four important causes, please note it down. So we have got staphylococcal scalded skin syndrome, bullous impetigo, pemphigus foliaceus and miliaria crystallina. So this is how they look. So just for your revision I am showing you this, I will not go into detail, right? So the mnemonic, so we have got foodie mnemonic for this blistering disorders. So one mnemonic is I had popcorn, fries burger with soft drink in movie. So popcorn, the mnemonic itself is having the topic subcorneal split, fries burger soft drink. So we have got pemphigus foliaceus for fries, pemphigus foliaceus because we have various subtypes of pemphigus, so we should remember F. So fries burger, burger is BU is bullous impetigo and we have got soft drink that is SSSS soft. So movie, so movie is malaria. So this foodie mnemonic, it is related to subcorneal split, right? Clear? Now we have got another group of disorder, suprabasal split, which is inside the epidermis but above the basal layer. So this is very important. So pemphigus vulgaris, pemphigus vegetans, and Darius disease, which is inherited acantholytic disorder, Darius. Now another food in mnemonic, veg besan vada. Yummy, isn't it? So veg is what? Veg is vegetans, pemphigus vegetans. We have got vada, so V is for vulgaris, DA is for Darius disease. What about besan? Besan is suprabasal. Suprabasal. So veg besan vada, it is suprabasal. So vulgaris and vegetans, you should remember, it is suprabasal intraepidermal. Pemphigus foliaceus is subcorneal intraepidermal. Right. So coming back to our question, they have mentioned suprabasal bulla. So what is the mnemonic for suprabasal bulla? Veg besan vada. So vegetans and vulgaris and Darius. So we have vegetans here. We also have vulgaris here. So forget about the two options. Now coming back to the clinical scenario. Now this is the basic. So everything cannot be solved by mnemonics alone. You have to correlate with what we have learned. So in pemphigus, vegetans and vulgaris, the clinical scenario is fitting with vulgaris. So vulgaris presents with flaccid blisters which can rupture to form crusts. Vegetans presents with vegetating plaques. So vegetans will present with vegetating plaques. That's why the answer here is not vegetans. It is vulgaris. So mnemonics definitely will help you, but you have to know the basics, right? So this is a picture of pemphigus where you can see erosions of pemphigus vulgaris. Here we can see superficial flaccid blisters. So they will rupture and they will form erosions, right? So this is how pemphigus vulgaris presents, whereas on the other hand, the subtype of vulgaris is vegetans. You can see vegetating plaques in axilla, folds, right? So vegetating plaques will be a clinical feature of pemphigus vegetans. That's why the patient was having vulgaris, not vegetans. Clear? Right. So another important group to differentiate is between vulgaris and foliaceous. So one difference you know, that foliaceous is subcorneal, whereas pemphigus vulgaris, it is suprabasal. So level is different. Now rule of alphabets you should apply in differentiation of these two. So pemphigus foliaceus is alphabet F, vulgaris is V. So alphabetically F comes first, V comes later. So A, B, C, D, E, F, G. So A comes first, B comes later. Similarly F comes first, V comes later. So this is superficial. Foliaceous is superficial, it comes first. Deeper is vulgaris. Clear between the two. And apart from this, the antigen that is involved here in vulgaris, against which the antibodies are being produced, is most commonly desmoglein 3, sometimes desmoglein 1 also, but most commonly antibodies are produced against desmoglein 3 in vulgaris, whereas in foliaceous it is desmoglein 1. Now how to remember this again? 1 comes first, 3 comes later, F comes first, V comes later. Rule of alphabets, so you can remember in this way. So you won't be confused, right? Similarly, rule of alphabets we should apply on the subtypes of pemphigus. So there are several subtypes of pemphigus foliaceus. One subtype is drug-induced pemphigus. Another subtype is Fogo-Selvagem, that is endemic pemphigus. Another subtype is pemphigus erythematosus, which presents like SLE. So malar region, the distribution of pemphigus foliaceous lesions, we call it as pemphigus erythematosus. Now how to remember that these are all the subtypes of foliaceous and not vulgaris, because they will ask you. So F alphabet. So we have alphabet D, F, E, E. All are near to F. Are they near to V? No. Alphabetically they are near to F. That's why these are all subtypes of pemphigus foliaceus. Whereas vegetans, V for V. So vegetans is a subtype of vulgaris. Isn't it simple now? Right. So let us solve this question. All the following are variants of pemphigus foliaceus except. So which of the following is not a variant? So erythematosus, E near F. Now we have drug induced D near F, F, F. Clear? So we have vegetans, which is a subtype of vulgaris, not foliaceous. Simple. So you should apply mnemonics. So another wonderful mnemonic, like, so Donald Duck, my favorite character. So mnemonic for pemphigus vulgaris, almost all the features you should know of pemphigus vulgaris are covered here. So the mnemonic is Donald Duck fishing, right? So Donald Duck fishing, we have D-O-N-A-L-D and fish. So D for desmoglein 3 antibody, as I have told you. In vulgaris we have most commonly desmoglein 3 antibody, less commonly desmoglein 1 antibody. Oral ulcers are very important features that helps you to answer the MCQ. If they mention oral ulcers plus blisters, think of vulgaris. Nikolsky sign, another important sign, positive here again, N for Nikolsky. We have A for acantholytic cells, very important finding, they will mention it. If acantholytic cells are present, it is pemphigus. In foliaceous also, acantholytic cells can be seen, but usually in question they ask about vulgaris, right? In pemphigoid, acantholytic cells are absent. Pemphigus vulgaris, it is present. And lower age group, L for lower age group, bullous pemphigoid presents at a later age group, 60 to 80s. Vulgaris presents generally earlier, 40 to 60 years of age. So lower age group compared to bullous pemphigoid. We have D, D is death stone, which is also known as row of tombstone. So when you take a biopsy of pemphigus vulgaris, we see that the basal keratinocytes are lying there attached singly like tombstone. So I'm not going to go into the details, just remember this, you can go back and read your basics. So row of tombstone appearance is seen in pemphigus vulgaris. So D for death stone. And ultimately you have the fish. So when we do direct immunofluorescence, what we see in pemphigus vulgaris? We see fish net pattern. So this is another MCQ, they give you a case scenario, right? So fish, so Donald Duck fishing is the mnemonic for pemphigus vulgaris. Clear till now? Right. Now look at this image. This image has been asked multiple times. So what is your diagnosis? So you can see here there is a single layer of basal keratinocytes above which there is a cleft. Rest of the epidermis is above. So this is intraepidermal suprabasal cleft. This is nothing but pemphigus, which type? Vulgaris. To be more specific, this is pemphigus vulgaris. Now pemphigus, anything intraepidermal, you can label it as pemphigus in immunobullous disorder, but the second type is pemphigoid. So here you can see the difference. So here you can see it is suprabasal cleft inside the epidermis. Here it is dermoepidermal, below the epidermis, and above the dermis there is a gap. So this is pemphigoid, most commonly bullous pemphigoid. In MCQ generally they will ask you about bullous pemphigoid. So pemphigoid and pemphigus, they are different. So pemphigus S means superficial compared to pemphigoid, which is D, D for deep. So this is our mnemonic, another mnemonic. Pemphigus, superficial. Deeper we go, dermoepidermal, we see deeper cleft, that is pemphigoid. Clear? Right. So coming back to various fishes in dermatology, just now we have seen in Donald Duck fishing, pemphigus vulgaris, fish net pattern on DIF. So what all other fishes are there in dermatology? So let us see. Fish net immunofluorescence, this you know, very important, pemphigus. Fishy order on adding KOH. So what is the answer? Whiff test in bacterial vaginosis. You remember it? So bacterial vaginosis, when we do whiff test, when we add KOH on the discharge, we see fishy order. So that is suggestive of bacterial vaginosis. What else? We have got Ichthyosis vulgaris, where we see fish-like scales. Another MCQ. When last, chancroid. So chancroid, we have school of fish appearance on gram stain, where we get gram-negative organism forming, right? They form fish-like pattern. So it's like they are swimming in the gram stain. So the bacteria arranged in line like school of fish. So remember this is very important. Each line is a potential MCQ. Alright. Now another thing about immunobullous disorder, like desmoglein 3, DSG3, DSG1 in pemphigus we have read. Here in subepidermal we have something known as BPAG antigen, BPAG2. So BPAG2 or BP180, it is also known as BP180. This is the most common antigen in these disorders. So these all are subepidermal disorders, and MCQ will be asked. The most common antigen in bullous pemphigoid is BPAG2. So the full form of BPAG2 itself, you can remember the mnemonic. So B, bullous pemphigoid; P, cicatricial pemphigoid; you have A, linear IgA disease or CBDC; then you have G. So in pregnancy we get a subepidermal disorder known as pemphigoid gestationis. So BPAG2 is the antigen in these disorders, right? Right. So drug of choice for disorder with subepidermal blistering with neutrophil macroabscesses is, so we have got neutrophil macroabscesses plus subepidermal blisters. So the diagnosis is dermatitis herpetiformis, and the drug of choice for dermatitis herpetiformis is dapsone. So linear IgA disease or dermatitis herpetiformis or CBDC, all the three group of disorders, all the three are subepidermal disorders. Neutrophil macroabscesses we see in dermatitis herpetiformis. So dermatitis herpetiformis, so all have one common thing. D, drug of choice is dapsone in all. Another mnemonic, simple mnemonic. So apart from that, gluten-free diet is also given in dermatitis herpetiformis. So what is the meaning of gluten-free? They ask in MCQ. So you can not have these substances which contains gluten. The mnemonic is BRO. Barley, rye, oat and wheat. Barley, rye, oat and wheat. And please remember, it is not rice, it is rye. So the limitations of your mnemonic you should also know, right? So otherwise in exam, if rice comes and you remember BROW, so rice was also there in the mnemonic, you will have false impression. But rice, it's not there in the mnemonic, it's rye. Rice is allowed, idli is allowed, right? Clear? Right. So this was all for today. I hope you enjoyed it.